So once again, my name is Gabrielle Richardson, and this is LinguaMD, which is a healthcare picture translation app used to enhance patient understanding of diagnosis and treatment. Next. After volunteering at a free clinic for 3 years, I've had the opportunity to take care of numerous patients with various disparities affecting their health. A few of these disparities include language barriers, minority status, special needs, and illiteracy. Being illiterate means a person is unable to read or write in their native language. One day, while I was at the clinic, I had a Hispanic patient, who we'll call Jose, come in for an exam due to various health concerns. Upon arrival, we asked our patients to complete a survey about their current health state, along with completing basic demographic information. Jose walked up to the front desk and quietly told us he didn't know how to fill out those forms because he never learned to read or write. I soon began to realize Jose's problem was far greater than filling out forms. This extended to his ability to understand the written instructions we gave him about his disease and treatment, as well as something as common as scheduling his next appointment. Next. This interaction with Jose led me to question, could an app be created and used to improve patient outcomes and efficacy of care? Who will use this app and how will it be paid for? Next. In order to answer some of these questions, I needed to complete product feasibility research. I began by examining the patient population at the free clinic I volunteer at. Over 70% of our patients cannot either speak, read, or write in English. Next, I discovered 10% of the adult population in the US is unable to read or write in their native language, and that the nation's total healthcare expenditure associated with special needs or cognitive impairments like a stroke or hearing loss has a total cost of $51.2 billion annually. This data was a pivotal moment for the development of LinguaMD. Next. The first discussion occurred with the UW-Parkside App Factory on whether a picture translation app such as LinguaMD could even be built, as well as the cost associated with it. UW-Parkside App Factory is a professional software development service which quoted the cost to build LinguaMD at $10,000. LinguaMD construction was instead incorporated into the curriculum of a software engineering course offered through UW-Parkside, reducing the cost to $0. Then I spoke to real patients and healthcare providers to determine where their need was. When discussing what patients and physicians would like to see in a medical app, accessibility and ease became one of the primary concerns for both parties. This ultimately led to asking what features would LinguaMD need to fill a wide range of both patient and physician needs while being accessible and easy to use. Next. The 3 unique features which distinguish LinguaMD from other apps and services that currently exist are picture translation, recording a diagnosis, treatment plan, and medication use, and machine learning to provide accurate medical interpretation. The leading medical translation app, Canopy Speak, which only has pre-made sentences which can be read to patients. The problem with pre-made sentences is it only tells the patient what the doctor is trying to communicate, thus creating a language barrier where patients cannot be understood when they communicate back. This appears to be no current solutions available for patients who are illiterate besides strictly verbal communication. But as we all know, we do not have perfect memories, and without an ability to write down information, the patient forgets and is unable to complete their treatment. The picture translation will allow patients to see what the provider is explaining, as well as have a saved picture record of the conversation to forgo the concern of illiteracy. The recording function allows patients to replay sections of their conversations with the provider so they can remember what they were instructed to do. This is useful to special needs or illiterate populations with impairments such as the elderly. Lastly, the app will have regular verbal translation function, which will use machine learning to continuously improve on the accuracy of translation. Next. LinguaMD works by the app automatically detecting the 2 languages which will be spoken between the conversation. Once the conversation begins, the app starts translating verbally and through writing. The words that have pictures associated with them are automatically detected and are highlighted so the patient can review those words later or to provide the physician the tool to easily click on the highlighted word to show the patient what they mean. This can also be seen on the left-hand side of the screen, and once the yellow highlighted word is clicked, it will appear as it is seen on the right-hand side of the screen, where the word pops up with the picture. Next. The business model for LinguaMD is heavily focused on partners, the channels in which we will be able to make this available to patients and providers, and the revenue streams. Our primary partners are the students who I have mentioned previously designing the app. Our second partner is the UW-Madison Law Clinic, which serves the purpose of discussing and drafting ways in which to protect the company from legal and health liability. The way in which LinguaMD will reach patients is through first being tested for 1 year in free clinic settings throughout Wisconsin. Throughout this process, we will receive feedback on how to modify the app for most satisfaction. Once it's gone through rigorous testing with the free clinics, it'll be offered to the various health organizations in Wisconsin on a free prototype basis. The way in which we will finance the initial prototype phase will be through the applications and the grants funding through the National Institute of Health. This is a US-funded government organization which frequently provides hundreds of thousands of dollars to conduct research or offer products to decrease barriers to health communication. Next. Once LinguaMD has gone through the 1-year market testing phase, its revenue model will be as follows. The fixed costs will include the consistent software update and improvement. The variable costs could include paying staff to train doctors and patients on how to use the app, as well as account for any unforeseen costs in the future. Revenue would be achieved through licensing LinguaMD to other health organizations. Next. Our next steps include applying to the NIH for a grant to fund the 1-year market experiment, using part of the funding to have the UW-Parkside App Factory officially complete LinguaMD on a professional level, and finally release the app to market. Next. Thank you. Are there any questions?